Hello student, good morning. Myself Sri K.D. Borse sir, biology subject teacher. In last lecture we learned respiration and circulation chapter content concept, blood pressure, arterial blood pressure. What is pulse pressure? We also learned in previous lecture hypotension and hypertension terms. Different factors affect on blood pressure. Today we are going to learn some more concept including respiration and circulation chapter, measurement of blood pressure. You know, blood pressure consists of two types: systolic blood pressure, diastolic blood pressure. We learn in today's lecture how measure blood pressure, what is actual systolic blood pressure and diastolic blood pressure. We also learn in today's lecture disorders of the blood circulatory systems like hypertension, number 1, coronary artery disease, CAD, and angina pectoris. Let us start today's first concept, measurement of blood pressure. You know, blood pressure consists of two types, systolic blood pressure and diastolic blood pressure. Blood pressure measured by one of the instrument known as sphygmomanometer. Blood pressure measurement instrument known as sphygmomanometer. Always remember term sphygmomanometer. Senior diagrammatic representation. This is the sphygmomanometer. Measurement of blood pressure. These instrument consist of number 1, inflatable rubber back cup covered with cotton bag. This is the cotton bag, cup covered inflatable rubber bag. Second point, such inflatable rubber bag, cup covered by cotton cloth, is connected with the help of rubber to mercury manometer. This is the mercury manometer, and this tube is connected to mercury manometer to inflatable bag, and other side a rubber like bulb. This is the rubber like bulb is connected to inflatable bag. Point number 3, during measurement, जेव्हा ब्लड प्रेशर मेजरमेंट करायचं असतं, the person is asked to lie in sleeping position. ज्या पर्सनचा आपण ब्लड प्रेशर मेजर करतो त्याला स्लीपिंग पोझिशन मध्ये करतो आपण आधी. पॉइंट नंबर 4, द मेजरमेंट ऑफ ब्लड प्रेशर इंस्ट्रूमेंट इज प्लेस्ड ॲट लेवल ऑफ हार्ट अँड कफ इज टाइटली वार्प्ड अराउंड अपर आर्म. ज्या पर्सनचा आपल्याला ब्लड प्रेशर मेजर करायचं आपण त्या पर्सनच्या अपर आर्मला कप काय करतो आपण, टाइटली वार्प्ड करतो. पॉइंट नंबर 5, द कफ इज inflated till the branchial artery is blocked due to external pressure. Cuff is inflated till the branchial artery is blocked. Then pressure in cuff slowly lowered. या रबर बॉल मधून आपण प्रेशर हळूहळू काय करतो, कमी करतो. देन प्रेशर इन कफ इज स्लोली लोअर्ड टिल द फर्स्ट पल्साटाईल साऊंड इज हिअर्ड. जेव्हा आपण रबर बॉल द्वारे ब्रांचियल आर्टरीचं प्रेशर कमी करतो आपण, तेव्हा फर्स्ट पल्साटाईल साऊंड आपल्याला ऐकू येतो with the help of stethoscope. Such first pulsatile sound is at this moment, जेव्हा आपल्याला फर्स्ट पल्साटाईल साऊंड हिअर्ड होतो, at this moment pressure indicate in manometer. This is the manometer. So first pulsatile sound is heard. At that time manometer contain pressure called as systolic pressure. You know, ventricles are contract systole. Such systolic pressure is measured when first pulsatile sound is heard, and at that time the pressure indicate in the manometer. Seen this pressure called as systolic pressure. You know, a normal person's systolic pressure is about 120 mm hug. So always remember, first pulsatile sound heard, at that moment the pressure indicate in manometer is systolic pressure. Sound here during the measurement of blood pressure called as corotoscope sound. Always remember, corotoscope sound is here during the measurement of blood pressure. Number 9, pressure in cup is further lowered till any pulsatile sound cannot be heard. जेव्हा प्रेशर इन द कप इज लोवर्ड, कमी कमी होत जातं कप मधलं प्रेशर, तेव्हा आपल्याला पर्साटाईल साऊंड कॅन नॉट बी हिअर्ड, मीन जेव्हा ऐकू येणं बंद होतं ड्यू टू स्मूथ ब्लड फ्लो. ॲट दिस मोमेंट जेव्हा आपल्याला पर्साटाईल साऊंड कॅन नॉट बी हिअर्ड, ऐकू येणं बंद होतं, ॲट दिस मोमेंट प्रेशर इंडिकेट इन मॅनोमीटर. ह्या मॅनोमीटर मध्ये असलेलं प्रेशर कॉल्ड ॲज डायस्टॉलिक प्रेशर. यू नो, डायस्टॉलिक प्रेशर इज normally is about 80 mm hug. So systolic pressure is 120 mm hug and diastolic pressure is 80 mm hug. This is the normal blood pressure measurement. If above the range of normal blood pressure called as hypertension, below the normal range of blood pressure called as hypotension, means high blood pressure, low blood pressure. Normal blood pressure level is about 120-80 mm hug. Always remember, up to this we detail discuss measurement of blood pressure with the help of sphygmomanometer. In the blood pressure measurement, two terms are most important: systolic pressure and diastolic pressure. Systolic pressure is noted when first pulsatile sound is heard. Diastolic pressure is noted when pulsatile sound cannot be heard. Hope that you understood everything. Up to this we detail discuss measurement of blood pressure. Now we learn disorders of blood circulatory system. Disorders of blood circulatory system. In our syllabus there are 3 different disorders of blood circulatory system. Number 1, hypertension, coronary artery disease, in short CAD, CAD, and third, angina pectoris, here noted. First disorder known as hypertension, second CAD, coronary artery disease, and third angina pectoris. We detail discuss one by one. First one is hypertension. How hypertension occurs? What is hypertension? Hypertension means blood pressure higher than the normal, called as hypertension. Blood pressure higher than the normal, called as hypertension. You know, normal blood pressure is about 120/80 mm/Hg. So when blood pressure is higher than the normal, such condition called as hypertension. Persistently raised blood pressure means hypertension. जेव्हा नॉर्मल पेक्षा जास्त ब्लड प्रेशर असतं त्याला आपण हायपरटेन्शन, राइज्ड ब्लड प्रेशर म्हणू शकतो. 140/90 mm/Hg is called as threshold hypertension. जे हायपरटेन्शन आपण सहन करू शकतो ते किती असू शकतं? 140/90 mm/Hg. 140 means systolic pressure and 90 means diastolic pressure. So what is threshold hypertension blood pressure? 140/90 mm/Hg is threshold hypertension blood pressure. Always remember, when 180/120 mm/Hg and higher reading, जेव्हा 180 हे सिस्टॉलिक प्रेशर असतं आणि 120 हे डायस्टॉलिक प्रेशर असतं किंवा त्याच्यापेक्षा हायर रीडिंग असेल तर सच ब्लड प्रेशर इज डेंजरस टू द हेल्थ. आपल्या हेल्थला 180 सिस्टॉलिक, 120 डायस्टॉलिक किंवा त्याच्यापेक्षा जास्त ब्लड प्रेशर असेल तर ते डेंजरस टू द हेल्थ असू शकतं. इट मे डॅमेज सच डेंजरस ब्लड प्रेशर. इट मे डॅमेज द हार्ट, ब्रेन अँड किडनी. आपली किडनी डॅमेज होऊ शकते, ब्रेन डॅमेज होऊ शकतो, हार्ट डॅमेज होऊ शकतो ड्यू टू डेंजरस ब्लड प्रेशर is 180/120 mm/Hg or higher reading. Number 6, under the condition of hypertension, जेव्हा हायपरटेन्शन कंडिशन असते, हार्ट uses more energy for pumping. हार्टला जास्त एनर्जी लागते कशासाठी? पंप करण्यासाठी. यू नो हार्ट इज पंपिंग ऑर्गन. सो ॲट दॅट टाइम मीन्स अंडर हायपरटेन्शन कंडिशन हार्ट युजेस मोर एनर्जी फॉर पंपिंग विच कॉजेस एंजिना पेक्टोरिस, द चेस्ट पेन. आपल्या चेस्टमध्ये पेन होतं आणि त्याला म्हणतो आपण एंजिना पेक्टोरिस. बिकॉज ऑफ हार्ट युजेस मोर एनर्जी फॉर पंपिंग. अप टू दिस वी डिटेल डिस्कस हायपरटेन्शन, सम कॅरेक्टरिस्टिक्स पॉइंट. नाउ ड्यू टू हायपरटेन्शन, रप्चरिंग ऑफ ब्लड व्हेसल ऑफ द ब्रेन. हायपरटेन्शनमुळे काय होतं? ब्रेन मधली ब्लड व्हेसल काय होऊ शकते? रप्चरिंग होऊ शकते. अँड ड्यू टू दिस मीन्स कॉजेस ब्रेन हिमोरेज. रक्तामध्ये ब्लडिंग होऊ शकतं. ब्रेन हिमोरेजने पुढे कोमात जातो पर्सन, हे पण आपल्याला माहिती असलं पाहिजे. ड्यू टू हायपरटेन्शन, rupturing of blood vessel of the brain causes brain hemorrhage. What is brain hemorrhage? Blooding in the brain because of a rupturing of blood vessel in the brain due to hypertension. In kidney, hypertension may causes kidney failure. जर किडनी मध्ये हायपरटेन्शन कंडिशन क्रिएट झाली तर किडनी काय होऊ शकते? फेल्युअर होऊ शकते. नंबर 9, ड्यू टू हायपरटेन्शन rupturing blood vessel of the heart. You know, heart contain tissue cells, provide blood to blood vessels, also collect from heart deoxygenated blood. Is also blood vessels are connected to the heart. When rupturing the blood vessels of the heart causes lowered blood supply to cardiac muscles of the heart. जेव्हा हार्टला ब्लड सप्लाय करणारी ब्लड वेसल रप्चर्ड होते तेव्हा हार्टच्या कार्डियक मसल सेल्सला ब्लड सप्लाय कमी पडतो. याचाच अर्थ ऑक्सिजन कमी पडतो. अँड ड्यू टू दिस मे लीड्स रिझल्टिंग myocardial infarction, also called as heart attack त्याला म्हणू शकतो, or heart damage. Means due to hypertension, heart damage, heart attack, myocardial infarction like conditions because of lowered blood supply to the cardiac muscle of the heart due to rupturing the blood vessels. Same condition when kidney hypertension, kidney failure, when hypertension in the brain, rupturing blood vessel of the brain causes brain hemorrhage. हायपरटेन्शनने होणारे परिणाम कोणाकोणावर होऊ शकतात? तर ब्रेनवर होऊ शकतात. ब्रेन हिमोरेज, किडनी फेल्युअर होऊ शकते, हार्ट फेल्युअर होऊ शकतो, हार्ट अटॅक येऊ शकतो आणि मायोकार्डियम इन्फ्रॅक्शन होऊ शकतं. सो अप टू दिस वी डिटेल डिस्कस. हायपरटेन्शन इज वन ऑफ द डिसऑर्डर ऑफ ब्लड व्हास्क्युलर सिस्टीम. हायपरटेन्शन डेंजरस असू शकतं ब्रेनसाठी, किडनीसाठी अँड हार्टसाठी. हे आपल्याला या ठिकाणी लक्षात येतंय. नाउ वी लर्न सेकंड डिसऑर्डर नोन ॲज कॉर्नरी आर्टरी डिसीज, इन शॉर्ट CAD. Coronary artery disease. You know, coronary artery supply oxygenated blood to cardiac muscles, tissue cells. So such coronary artery occurs disease. How occurs coronary artery disease and what is its effect on the body, and how coronary artery disease is a disorder of blood vascular system. We learn in detail coronary artery disease. Coronary artery disease is a condition in which very less supplying blood to the heart cardiac muscles, very less supplying blood to the heart cardiac muscles due to narrowing the lumen of coronary artery, called as coronary artery disease or CAD. Coronary artery disease मध्ये very less supplying blood to the heart cardiac muscles because due to narrowing lumen of coronary artery. Coronary arteryचा lumen काय होतो? Narrowing होतो. And due to this, very less supply blood to the heart cardiac muscles. such condition called as CAD or coronary artery disease. CAD is also known as atherosclerosis. You know, atherosclerosis means deposition of fatty acids or fatty material like cholesterol in the lining of artery. Such condition called as CAD. Due to atherosclerosis, narrowing the lumen of coronary artery. जेव्हा coronary arteryच्या internal lining मध्ये फॅटी ऍसिड मटेरियल इंट्रोड्यूस होतं तेव्हा कॉर्नरी आर्टरीचा ल्युमेन काय होतो, नॅरोइंग होतो. अँड दिस कंडिशन इज atherosclerosis. Atherosclerosis occurs because cholesterol, calcium, fat get deposited in the blood vessels like coronary artery. Why coronary artery lumen is narrowing? Because calcium, fat and cholesterol get deposited in the blood vessel like coronary artery. Due to this, narrowing the lumen of coronary artery. Now point number 3, you know, atherosclerosis occurs because calcium, fat, cholesterol get deposited in the blood vessel like coronary artery. Due to this, narrowing the lumen of coronary artery, such disease called as CAD. जेव्हा कॉर्नरी आर्टरीचा ल्युमेन नॅरो होतो तेव्हा त्या कॉर्नरी आर्टरीला जो डिफेक्ट डिसीज झालेला आहे तो काय असेल तर CAD असेल, कॉर्नरी आर्टरी डिसीज. ड्यू टू CAD means narrowing the lumen of coronary artery, very less supplying blood to the heart cardiac muscles. Heart cardiac muscles ला कमीत कमी ब्लड सप्लाइंग होतं, मीन्स कमीत कमी ऑक्सिजन सप्लाय होतो, which causes resulting damage the heart or sometime heart attack like condition. Due to CAD means narrowing the lumen of coronary artery. Up to this we detail discuss coronary artery disease is one of the disorder of blood vascular system and it directly affected to damage of the heart or heart attack like condition create because of narrowing the lumen of coronary artery. While narrowing the lumen of coronary artery, because calcium, fat and cholesterol get deposited in the blood vessels of coronary artery, such condition called as atherosclerosis. So CAD is also called as atherosclerosis. Always remember, up to this we detail discuss coronary artery disease or CAD in detail. Now we learn third disorder of blood vascular system is known as angina pectoris. We learn what is actual angina pectoris. Angina pectoris is a condition of pain in the chest. एक अशी कंडिशन जी चेस्ट मध्ये पेन क्रिएट करते. पेन म्हणजे दुखावा. अ कंडिशन ऑफ पेन इन द चेस्ट ड्यू टू रिडक्शन ब्लड सप्लाय टू कार्डियक मसल्स ऑफ द हार्ट. जेव्हा हार्टच्या कार्डियक मसल्सला कमीत कमी ब्लड सप्लाय होतो, म्हणजेच कमीत कमी ऑक्सिजन सप्लाय होतो. ड्यू टू दिस त्याच्याने काय होतं तर पेन इन द चेस्ट लाईक कंडिशन, बिकॉज atherosclerosis and arteriosclerosis, such condition called as angina pectoris. What is angina pectoris? A condition of pain in the chest due to reduction blood supply to cardiac muscles of the heart because atherosclerosis or arteriosclerosis, such condition called as angina pectoris. You know, atherosclerosis means deposition of fatty material, calcium, cholesterol in the inner lining of coronary artery. Also, arteriosclerosis means hardening of the artery, such condition called as angina pectoris. In angina pectoris, one of the characterized by serve pain in the chest. चेस्ट मध्ये पेन सर्व होणं मीन्स एंजिना पेक्टोरिस, आणि एंजिना पेक्टोरिस होतोय क्रिएट होतोय मीन्स reduction blood supply to the cardiac muscles of the heart. The pain may be spread to neck, lower jaws, left arm and left shoulder is also. Angina pectoris characterized by severe pain in the chest. Such pain is spread to neck also, lower jaws, left arm and left shoulder is also. The pain usually result from exertion. पेन होण्याचं कारण exertion. When heart demand more oxygen but narrower blood vessel cannot supply, as a result does not fulfillment require the demand. Due to this, heart damage, heart attack like condition create. Up to this we detail discuss. Angina pectoris is one of the danger condition, create pain in the chest due to reduction blood supply to cardiac muscle of the heart due to atherosclerosis or arteriosclerosis, such condition called as angina pectoris. And angina pectoris is serve as pain in the chest. Such pain is spread neck, lower jaw, left arm, also left shoulder. Such pain is usually from exertion, and heart demand more oxygen but narrower blood vessel cannot supply fulfillment required demand to the heart, and due to this heart damage, heart attack like condition create. Up to this we detail discuss all three different disorders of blood vascular system like hypertension, coronary artery disease, CAD, and angina pectoris. A review today's topic. We learn in today's lecture measurement of blood pressure. You know, blood pressure measurement, two main conditions, systolic blood pressure and diastolic blood pressure. In systolic blood pressure, normally 120 mm hug. Diastolic blood pressure, normally 80 mm hug. disorder of blood circulatory systems like number 1, hypertension. You know hypertension, threshold hypertension about 140 systolic and 90 diastolic hug blood pressure. Dangerous hypertension 180 systolic, 120 diastolic hug. We learn in detail coronary artery disease, CAD. CAD is also known as atherosclerosis. You know atherosclerosis means deposition of fatty material in internal lining of artery. Due to CAD, damage of heart. We also learn angina pectoris, characterized by sharp pain in the chest. Due to angina pectoris, heart damage or heart attack like condition create. On the basis of today's lecture, some exercise question noted here. MCQ questions. Number 1 first. Angina pectoris is caused due. Hello student, good morning. Myself Sri K.D. Borse sir, biology subject teacher. In last lecture we learned respiration and circulation chapter content concept, blood pressure, arterial blood pressure. What is pulse pressure? We also learn in previous lecture hypotension and hypertension terms. Different factors affect on blood pressure. Today we are going to learn some more concept including respiration and circulation chapter, measurement of blood pressure. You know blood pressure consists of two types, systolic blood pressure, diastolic blood pressure. We learn in today's lecture how measure blood pressure, what is actual systolic blood pressure and diastolic blood pressure. We also learn in today's lecture disorders of the blood circulatory systems like hypertension, number 1, coronary artery disease, CAD, and angina pectoris. Let us start today's first concept. What is hypertension? Yes, when above the normal range of blood pressure, such condition called as hypertension. Why hypertension is dangerous to the health? Yes, due to hypertension, damages of brain, kidney and heart. So hypertension is dangerous to the health. How occurs brain hemorrhage? Yes, due to hypertension, breakdown of blood vessels in the brain create blooding in the brain, such condition called as brain hemorrhage. What is CAD? Yes, a condition in which coronary artery lumen is very narrowing due to atherosclerosis. Such condition called as CAD or coronary artery disease. Angina pectoris is characterized by, yes, sharp pain in the chest. Difference between arteriosclerosis and atherosclerosis. Yes, arteriosclerosis means hardening of arterial blood vessels, and atherosclerosis means deposition of calcium, fatty material like cholesterol in the internal lining of artery. Now, what is arterial blood pressure? Yes, the pressure is exerted by blood on the wall of the artery, such condition called as arterial blood pressure. Why heart demand like more oxygen does not fulfill meant during the condition like angina pectoris? Yes, because narrowing of coronary artery lumen is not fulfillment a requirement of demand to the heart of the more oxygen. CAD, also known as atherosclerosis. Name the blood pressure measurement instrument. Yes, sphygmomanometer. Sphygmomanometer is an instrument specially for measurement of blood pressure. Match the term column A with column B. In column A, blood pressure higher than the normal. Blood pressure higher than the normal. Hypertension condition. During the blood pressure measurement, first pulsatile sound is heard. Yes, at that time, systolic pressure means 2 match with A, 1 match with C. During blood pressure measurement, pulsatile sound cannot be heard. Yes, diastolic pressure means 3 match with D. Blood pressure lower than the normal. Hypotension means 4 match with B. Identify the given instrument and give its significance. Yes, this is the sphygmomanometer instrument. Its most important significance is measurement of blood pressure. Up to this, today's lecture completed. Hope that you understood everything. If you like the video, then you can subscribe my YouTube bioinfo channel. Tap the bell icon and like the video. If any doubt about today's lecture, mention in comment box. Thank you.